Welcome to the Anatomy of Alignment, a biomechanical blueprint for reversing tech neck. This video will explore the anatomy of proper alignment and provide actionable steps to correct the common modern ailment known as tech neck. Forward head posture significantly increases the load on your neck, doubling it for every inch of forward drift. This excess load leads to nerve irritation and chronic fatigue. Tech neck is rooted in upper cross syndrome, a structural imbalance where certain muscle groups become tight and others become weak. This traps the chest forward while the back of the neck strains to keep your eyes level. The musculoskeletal diagnostic matrix categorizes muscles as tight and facilitated, or weak and inhibited. Our target actions will be to stretch the tight muscles and strengthen the weak ones. Begin by calibrating your environment. Ensure your monitor is at eye level, your head is in a neutral position, and your hips and knees are at 90-degree angles. Also, take standing breaks and use a monitor stand. Optimizing sleep posture is also crucial. Use a rectangular pillow if you sleep supine, or a cylindrical one if you sleep laterally, to maintain the natural alignment of your cervical spine. Rehabilitation is a three-phase ecosystem, releasing tension, building endurance, and correcting posture. Success requires simultaneously releasing tight muscles and activating weak ones. The chin tuck is the keystone mechanic. Avoid tilting your head, and instead, glide your head straight back as if making your neck longer along a wall. Hold this for 5 to 20 seconds, repeating 10 times. Phase 1 focuses on releasing tension. Practice the upper trap stretch for the side and back of the neck, the doorway stretch for the chest, and the desk stretch for the front of the shoulders. Hold each stretch for 20 to 30 seconds. Phase 2 is about activating inhibited muscles. Perform neck extensor activation to strengthen postural muscles and the scapular pinch to pull shoulders out of a rounded position, avoiding shrugging. In Phase 3, correct and integrate new posture with wall angels, which open the upper thoracic area, and resistance band rows, which train activated stabilizers while maintaining a neutral head position. For holistic maintenance, incorporate movements like cat-cow to release joint tension, thread the needle for shoulder stabilizers, and child's pose for passive elongation of the latissimus dorsi. The clinical rehabilitation timeline progresses from acute pain management in weeks 1 to 2 to initial strengthening in weeks 3 to 6 and focuses on stability in weeks 6 to 12, leading to long-term prevention after week 12. Implement the 24-hour posture prescription daily. This includes the desk standard, the sleep standard, and the 3-move maintenance routine: doorway pec stretch, chin tucks, and wall angels. Alignment is a system. Calibrate daily.